Hi everyone, welcome back to Keeping Up with the Chaldeans. I'm Anthony Toma, your host. We're here today with Milad Chirco of Birmingham Holistic Dentistry. First, we want to find out what holistic dentistry is. Can you explain that to our audience, please?
Thank you, Anthony, for having me. Holistic dentistry, it's not a new branch from dentistry in general. It's not a specialty. It's just a different thought process and also attitude in performing dental procedures to achieve the goal of modern dentistry.
Gotcha.
Okay, so we use the safest, the least toxic dental material out there. Not only dental material, but dental procedures too.
And talk about the differences between the two. I know you said least toxicity or toxic. What else is a difference between the two?
There's a lot.
Okay, let's break it down.
There's a lot in common and there's a lot different.
Okay.
So one of the main things that separate holistic dentists, biological dentists versus conventional dentists is the fluoride. Okay, so we know fluoride in their studies, and there's many lawsuit case. One main lawsuit case against the EPA, because now they know that the fluoride lowers the IQ and increases the potential of attention ADHD.
Yep.
Okay, and the systemic effect, and you could have even what we call dental fluorosis if you have high levels of fluoride. So
In your
basically,
system.
in your system, yeah.
Okay.
And then you can have dental fluorosis, you can have bone fluorosis. That doesn't mean it's happening here, but sometimes in third world countries where they even have it, they have in their water natural fluoride, but they're getting a lot of fluoride. Okay, so there's difference also between natural fluoride and there's artificial fluorides. Obviously, the fluoride that we get in the water is artificial fluoride.
Oh, really?
Yes. So if you go back in chemistry, fluoride is the 13th most abundant element on Earth, the natural, okay? It's very reactive. It's highly reactive to everything and anything. So I always tell the patients the fluoride, yes, it will bind to the tooth structure particles and will cause a very strong links. It's called fluoroapatite that will make the tooth resistant to cavities, but sometimes what happens is seals over a cavity, big enough cavity, and also we know the systemic effect that it's neurotoxic. It even competes with the iodine receptors in our thyroid, so it will push the iodine away and takes its place. So the fluoride and the chlorine, they're highly reactive. So fluoride is not fluoride is being highly used in dental products. So the dental product that I use in the office, they're fluoride free.
Right.
Whether it's a filling, whether it's a cement that we use to cement crowns, inlays and onlays, it's fluoride free. So that's the fluoride. And also the toothpaste that I give the patients, it's called Risewell over here. There's so many good brands out there, but this is the brand what I've been using personally for the past 5 years. It's fluoride free, it's paraben free, it's SLS free.
What are these paraben, SLS, and
So these
fluoride?
are all hormonal disruptors, and they're carcinogenic too. So if you even go to Target now, you'll see a section, shelves, that this shampoo has paraben-free, SLS-free. So if you don't want it in your shampoo and hair products, you don't want it in your toothpaste that you're using in your mouth, right?
Right, but so why is it in there in the first place?
So the SLS, for example, sodium lauryl sulfate, is the foaming agent that gives you, so when you brush your teeth, it gives you that false, the false feeling that you're cleaning your teeth better. It gives you like fresh breath.
Like suds.
Yes.
In a car.
Yes. So it's it's a hormonal disruptor.
It's a sales piece. It's a sales piece. Yeah.
So with this toothpaste, there's so many. There's Risewell, there's Boca, there's Revitin. There's so many great products over there. It doesn't have fluoride because you don't want to replace something foreign to your teeth and to your body.
Of course.
So if you want to protect your teeth, you use hydroxyapatite crystals, which is the main mineral in our teeth and bone. Okay, so if you want to replace it with something more natural.
And so where do you get that? Where do you get that? And how do you?
You get it on subscription online. I sell it in the office, same price. It's safe, it's clean. Yeah.
How do you apply it, or how do you?
It's a toothpaste, so you can.
Oh, okay.
Yeah. So you brush
So it's in this toothpaste.
Yes.
Oh, okay, okay.
So that's your daily toothpaste.
Okay.
So, but what it does, it has the hydroxyapatite, so it helps to remineralize
I see.
beginning of cavity. So if you have a beginning of cavity, it's only in that thin shell, the enamel, this will remineralize it. So you brush your teeth, you floss, and you can apply another layer of the toothpaste on your teeth, and you go to sleep. Okay, you don't
So
have
that's
to rinse it.
replacing the action of the chloride.
The fluoride.
Fluoride,
Yes.
sorry.
Yeah, yeah.
I'm not
Yeah.
I failed out of high school, so I'm not trying to give the medical terms here, but we tried. So where are you located? How can people find you? That people that want to learn more about, and we're going to teach them a lot more about what we want to do. But let's
all kind of gyms are surrounded by gyms, yoga places, yoga place for kids too. My son, he does martial art. There's Birmingham martial art there too. And Birmingham Racket Club too for tennis, ice arena. So that area.
Cole Street Collision.
Yes, Coastal Collision. Yeah.
All of them. Everyone's there. Okay, so now they know where to find you. Who do you think should come to you? And I know it's everybody, but you said that mothers with children that are concerned about what's in our food and what's in our toothpaste and the things that are going on with health.
Yep.
And so explain that part and that benefit of why they should come to you.
So it's beneficial for everyone, obviously. It's not only for that, but I feel like more the patient's clientele, the age I'm attracting, they're mothers with kids.
Yeah.
They're my age. So I'm in my 40s. At this time in my life, I'm a little bit more,
Cautious.
and settled. I have time to think for myself. At first, when you're in school, you're busy. You want to just finish.
Yep.
And when you finish, you want to work to pay off your
There's a
student
rat
loan.
race. Yeah, of course.
So because to me, it didn't happen overnight. It was a gradual change in a lifestyle. I have 3 kids. Sophia, she's 13. Angela is 10, and Adam, tomorrow he's gonna be 7.
Oh, God bless them.
Yeah, thank you. So it started when I started having kids. I started questioning many things, including the baby formula. Okay,
Yeah.
so I had to go back to work. My husband, he's a stay-home dad until we open a practice. So I couldn't breastfeed my kids for a long time, for a month or so.
Yeah.
But that idea started coming because I wanted to provide the best for my kids. So I started questioning what's in the baby formula that I'm giving my baby, Sophia, when I'm away.
Yeah.
And I always ask my husband, ask the pediatrician to see if the ingredients are okay. And always they said, yeah, don't worry, it's FDA approved. But then come to find out, now I know what to look.
It
has all bad ingredients.
Oh, boy.
And it's one thing led to another. I remember I used to give my daughter, Sophia, when she was 2, Cheerios, the colored one.
Yeah.
And then that changed after, a while, because I started looking into what's the GMO, what's the non-GMO,
Yeah.
what's the organic and all that. And I started reading more about the ingredients. And one thing led to another. It's from my hair product. I start switching the hair products to my mascara. And then, of course, obviously more cautious of what we're bringing home or what we're eating. And then led to dentistry. So it's the reason why I said moms of kids, because as a mom of 3, obviously you want to do the best for your kids. So if you know there's so many moms out there, they know that the fluoride is not a good thing to have, but they don't know why, but they're looking for a dentist that doesn't use fluoride, okay? And that's, that's most of the biological dentists, all the biological dentists, they don't use fluoride. And there isn't many out there. There's only few in the state of Michigan and all throughout the United States. And even if you go to Germany, there isn't many. There's so many conventional dentists, but to have that thought process and that attitude, there isn't many. But I see it's growing. So again, moms with children, anybody. So I see the patients, they're between 30 and 40. And I have patients 20 years old. They know more than I did what I knew when I was their age. And I always tell, you know what, good for you.
Yeah.
Yeah.
Well, there's the internet, so all of the
Of course,
information's
yeah.
out there, and everybody can look it up for themselves and realize that there are alternatives out there.
Mm-hmm.
What are some of the things, and I don't want to get too far away
Yeah.
from, the business and make this a
Yeah.
public service announcement, but what are some of the key ingredients that we should look for as parents that should be eliminated completely?
In what? Like
In food, in
Of course,
anything that you kind of uncovered yourself.
So obviously number one is sugar. Sugar, you find it everywhere,
Yeah.
But refined sugar, anything that has, and there isn't actually an app that my son, he walks around Costco and he
Really?
scans items.
God bless
There's
him.
so many items, there's so many apps out there, but there is one that I always talk to patient about. It's called Bobby Approved app.
Bobby,
Bobby Approved.
like Babby,
Yes, Bob.
like my dad.
Bobby.
Bobby,
Bobby.
okay.
Bobby approved. So
Bobby
it gives
approved.
you it gives you a thumbs up if the product is clean.
Really?
It gives you thumbs down if it's not clean, and then it will highlight why. So is it because it has sugar, cane sugar? Because if it's has natural flavors, or because natural flavors and artificial flavors are the same.
Right.
Okay, so they all both have tons of chemicals in them. So these are the things that I look. Obviously the oils that the inflammatory oils like
Right.
seed oils and all that. There's so many bad ingredients out there. I can't remember all of them, but use the
Right,
app.
for sure. Yeah, use the app for sure. It's Bobby approved, and we're going to put it in the description below if
I
you want
should
to find
tag
it.
him.
For sure.
I
Yeah,
should
yeah.
tag the guy.
So before we started rolling,
Yeah.
we said that when we were talking about ingredients, that a lot of the ingredients that are here used in the United States are
80%,
80% are banned
In Europe.
Banned in Europe.
Yeah.
That's mind blowing, really. That a country doesn't. One country cares about their citizens and one doesn't because
It's not about caring. So like every country is different, obviously, and every country has the good and bad things. I think in food industry we're lacking behind.
Right.
But for example, like I didn't know in Germany you cannot homeschool your kids.
Oh,
So every country has its goods and bads.
Right.
But it's good to know what to stay away from.
Right,
Okay.
right.
So I have so many patients, they homeschool their kids, but then I met a German dentist. He's a biological dentist. He
Yeah.
has 6 kids. He moved to he's not 100% if he wants to stay in the U.S. He's either moving to Canada or Costa Rica, but he said they couldn't homeschool their kids. So there's also some things that you cannot get in Europe, you can get it here, and vice versa.
Right.
Yeah.
So everything that a traditional dentist office can do, you can do.
Yes.
You have the full setup there. Like they're walking in and they're walking into a dentist office. So talk about the misconceptions.
Misconceptions, patients, they think that they come to us and we don't use a local anesthetic.
Yeah.
With no injections.
Yeah.
They think that we don't take x-rays. We have to take x-rays
Yeah.
because you cannot diagnose. You go to an emergency room, you break an arm, they're going to have to take x-rays to
Right.
see that. So we don't have those x-ray eyes to look what's behind the tooth structure. So x-rays is a must, but obviously we use digital x-rays, which minimum radiation. Even I have a 3D cone beam, the 3-dimensional x-rays for the head and neck region. I chose the green CT, lower radiation, okay? But if you fly from here to New York, you get more radiation than you get from dental x-rays.
Gotcha.
So x-rays, not to be worried about, but holistically, if you don't like the effect after the x-rays, you can do detox. You can go to infrared sauna, You can do Epsom salts. You can increase your vitamin C to minimize or decrease the free radicals that the radiation causes. But you're
That's
getting so much
interesting.
radiation from the cell phones, from,
Yep.
all the electronics. So this is not different. Yeah.
So you take kids,
Kids,
teens, adults,
yes, yes.
elders.
From babies to
Yeah.
elderly patients. The
So
only thing that I don't do is a root canal.
root canal.
No, I did not buy any single tool to do a root canal. What I do, I send to a biological root canal specialist. And I have a beautiful team of providers.
Right.
They have the same mindset. So I'm not against root canals, but I'm against root canals that are done conventionally. So when you do root canal, you irrigate with certain irrigants. Those irrigants, they only penetrate certain amount of thickness of the tooth. It doesn't go full thickness. So, when you look at the tooth, the anatomy of the tooth, it's not a hard structure. When you look under microscope, it's a sponge. It's full of holes. So especially with patients,
Wow.
they come in with necrotic, like with the tooth completely, the nerve is dead. That tooth is full of bacteria. That you cannot clean it properly with just irrigation. What you need to use laser. With the power of laser, you can not 100% guarantee, but you can guarantee most of the infection is gone. And also ozone therapy. Have you heard of ozone?
No.
Okay, we'll talk about it. So I have Dr. Chad Spears. He's in Birmingham too. His wife, she's an orthodontist. She's a airway center too. So these are so for patients with braces issues, they need expansion. I send to her. I do Invisalign in my office, but she's more airway centered.
Okay.
For patients with snoring and other stuff, for especially kids. He does my root canals, and I have a biological periodontist, gum specialist. She also uses laser and ozone therapy. So I have a nice network of providers. So if
for sure.
something that I cannot do, I know where to guide them.
Right. And that are aligned with the holistic.
Yes. Yeah.
Okay.
Absolutely.
So it's fillings, clean. So sometimes we go for fluoride treatment.
Oh.
Not now, not
Yeah,
when we
yeah.
were kids.
Yes,
This
yeah.
I'm talking a long time ago.
Yeah.
You don't recommend that,
No.
and you wouldn't do that.
No.
Is there a replacement for that?
Yes.
But-
So that is the replacement just came out very
Recently,
There
okay.
is a hydroxyapatite fluoride, where
Why do they call it fluoride?
hydroxyapatite varnish.
Varnish,
Sorry.
okay.
So there is a fluoride varnish, and that's the one that's sticky, that sticks on your teeth.
Yeah.
And also there is now a newer product that was
Introduced?
introduced by a retired biological dentist and a
Okay.
pediatric dentist.
Awesome.
Both from California. No, the pediatric dentist is from California. He's from different state. But they combined and they came up with this product this beginning of this year. So it's called hydroxyapatite. Again, remember the hydroxyapatite is the main mineral in our bone
Yeah.
and teeth. So that is a varnish. Okay, so it sticks to your teeth. But even in order for the material to stick to your teeth, they use certain chemicals. So the fluoride varnish, beside the fluoride that is bad, the ingredient that makes it sticky to the tooth is also highly toxic.
Oh boy.
Okay, so the hydroxyapatite varnish is different. It's
Right.
cleaner, and yeah, it's
So what's
as
a-
effective as the fluoride.
Well, so what do you recommend a daily routine, and then a schedule to visit your practice?
Okay, so daily routine, obviously brushing and flossing. So brushing at least twice a day.
Okay.
When you wake up in the morning, and the most important time to brush is at night. Okay. Flossing, no mouth rinse, no mouthwash whatsoever, because all the mouthwashes are bad.
Oh, don't use mouthwash, but
Don't-
what about water though?
Water, yes. yeah.
Okay, okay.
But some patients, as their daily hygiene routine, they use mouthwash.
Right.
And they think, oh, this is going to give me a fresher breath. Yes, it's going to give it to you for a short period of time, but you're disinfecting the good bacteria in
Bacteria.
your mouth. You want to keep that microbiome stable.
Yeah.
By doing that, by using the mouthwash, beside it has, some of them, they have alcohol, and that's the worst one because it evaporates and makes your mouth dry.
Yeah.
And good environment for the bacteria to grow and grow fast. and it has all those dyes. That's why you see the mouthwash. Some of them are blue, some of them are green.
Pink,
So
purple.
Yeah. So you want to stay away from mouthwash completely unless it's being prescribed by your dentist, but it has to be herbal. So
Right.
I have a clean product. It's called Stella Life. I give it to patients that has periodontal disease, that they had a surgery or they're going through a surgery. It has all kind of calendula, chamomile, all herbal or flowers that they're known to be
Natural.
antiseptic. So you're using a clean product, and they're not using it for a long period of time. So daily
Right.
routine, brushing, flossing, yeah, and seeing the dentist.
Yeah, the
Everyone's
schedule.
different.
Like, what's the schedule that someone should?
Everyone is different.
Okay.
So some patients, they need to be seen every month, believe it or not.
Really?
Yes,
How,
because
how did they know that? Like, what are some of the signs that would tip somebody off to say, hey, I got to go see the dentist?
it's so hard to plant that idea in the patients. I'm telling the patients, because being also biological holistic, you're tailoring the treatment plan to that patient. Okay, so who needs more frequent cleaning? Pregnant ladies.
Okay.
Okay, they need it every 2-3 months because of the hormonal changes in your body. That makes it, it exaggerates the reaction. So any little buildup or tartar buildup or a plaque in your teeth, it aggravates the gum. They have more bleeding, and you're caring for a baby. So whatever is going in your mouth, it's going to your baby.
Right.
So I recommend, but I don't get that all the time. I recommend 2 to 3 every 2 to 3 months. Patients with braces, it's so hard for them to clean their teeth
Yeah.
with all the brackets and wires. So I have patients. I have one patient that comes in every month because it's so hard to clean, and I show them because I stain it when they come in. I said,
Yeah.
look at all that plaque. This is what you're gonna have. You're gonna have cavities after you're done with the treatment.
Oh, no.
So some moms, they said, you know what? We're gonna book every month. And some patients, they need it once a year. But as a general rule, twice a year. It depends on the patient.
And that's a sit down, thorough cleaning, scraping, scratching, scraping.
So what I use in my office is completely different. It's a Swiss technology. It's newer to the U.S., but it's been used in Europe for many years. But they're still working. Like every year, they come up with a different handpiece. So it uses natural sugar, which is erythritol powder, very, very fine powder. It's 14 micron. So the process is different. So when you go and get your teeth cleaned, they scrape first with hand instrument or scaler, and then they polish with those,
yeah.
or they polish with those useless rubber cups. They're useless.
Really?
Because when you stain
But
the
they
teeth,
use an abrasive paste or
it's
something. What is
abrasive,
that?
and most of them, they have fluoride. And what it does, it just pushes the plaque to the sides. So yes, it's like a circular, and you're brushing, but it's pushing it to the
So
side.
they're not getting in
No,
you're just
no.
getting a flat surface.
Yes.
This is like mopping the middle of the floor and leaving the edges.
So what I use Airflow Master. It's a Swiss technology. This is like a power wash. Imagine you power washing
Right.
your deck
Yep.
or the wall. It's
Yeah.
exactly the same thing. I stain it. Everyone gets it. It's like part of the regular cleaning. The 5-year-old and above, they get this cleaning.
And is it painless?
Painless.
Okay.
And like what I've been getting from patients, they always say this is the best cleaning they ever had in their life, because
It's annoying the way they do it. Not what
Yeah.
I've not had your treatment, but the way that the regular dentists do it, it's really, really annoying.
Yes.
Yeah, really annoying.
Yeah. This is
So
more pleasant
experience.
experience.
So when I go, it takes about 45 minutes for them to clean. What's the time on this one?
Almost the same time,
Okay.
but you have more time educating the patient versus actual, it depends on the patient's, buildup. I have patients, there's barely anything in there. And even when they sit down, I'm like, I'm going to stain and I'm not going to see anything on their teeth. I'm so embarrassed because I want to always show them something,
Yeah.
right? And then to my surprise, I see all that biofilm because I'm staining it. So
Yeah.
I see it. When you look and you see just bright, beautiful teeth, I'm like, oh my God, when I'm going to stain, I'm not going to show them anything. But then I show them like, oh my God, there is plaque here, plaque there. So it's not to make the patient, feel bad, but It's more for
It's an
educating patients,
educational
and
piece,
also the machine that I use. It's a treatment called guided biofilm therapy. So whatever the biofilm is, I'm going to go after it and flush it.
Gotcha.
Even on the chewing surface, I've been practicing since I graduated from Boston Tufts University 2010, and I've been working since then. Every time I go do an exam after hygienist, most of the hygienists, I'm not going to say all of them, most of them, they don't clean the chewing surface, that chewing surface. And so when I go look for the cavity, I have to scrape through plaque to check and see if there's cavity in there or not.
Yeah.
Not to bash the hygienists, but this is because this is how they were trained.
Yeah.
Cleaning just the smooth surfaces.
Yep.
But then you have all those on the chewing surface. You have the grooves.
I have tons
Yeah.
of them.
Yeah,
I can feel them now.
with that technology, so with the regular cleaning, you're getting 50% of removal. This is not a number from me. This is from the studies.
Yeah.
50% removal of the plaque, versus with this Swiss technology, 99% removal of the plaque. So patients, they feel the difference because they feel every single surface in their teeth is smooth.
Yeah.
Including the chewing surface. So 5 years and older, the only contraindication for a patient with severe breathing issues, like COPD, those are the patients maybe that I should be, not do it. But even with COPD patients, they're fine with it. This is only in severe cases.
Gotcha.
So that's the cleaning. Yeah, and then I do saliva testing.
Oh, yeah. We mentioned that
Yeah.
before we started rolling. That's really important.
So I did at first, when I got my training, I was, they said, just test everyone because you never know. I didn't take their word. And I was picking and choosing when I first opened my practice. I'm like, okay. But then, even with my tests, I was surprised.
Yeah.
So I'm like, you know what? Everyone's testing.
Let's
testing
talk about
everyone.
what the test is and what it's looking for and what the benefits are and what the dangers are if you don't identify.
Okay. So that's a big thing for us to identify, and then what's next?
Yeah.
So always patients, they say, okay, you found out what to do next. So we test for 5 main pathogens. Those are the most aggressive pathogens. We have millions of bacteria in our mouth. We have good and bad. But these in particular, those 5, they're in the red zone. They call them red bacteria because once they break through the epithelium, the lining of your pockets and your gum, they go through the bloodstream. They're known, studies shows that 70% patients with Alzheimer, when they did the autopsy, they found this bacteria that should be only in the mouth. We all have them, but once they become super strained and they overpopulate, they start traveling through your bloodstream. So 70% patients with Alzheimer, when they did the autopsy, they found this type of bacteria, that causes periodontal disease.
What is the purpose of the bacteria in the first place, that particular bacteria?
So we're all made, our human body made of it's all about balance.
Right.
So I don't know what's God's idea about good and bad bacteria, but it's all about balance.
Okay.
So they're always under check because your immune system, if you have a good immune system, and if you look under a microscope and you see how funny that the white blood cell goes after the pathogens, it's like running. It's like a
Pac-Man.
Tom and Jerry.
Hey,
it's
no way.
running after it to capture, to engulf that. So we all have those, but they have to be under check.
That's visible to the naked eye?
No, under microscope.
Okay.
Yeah, but you can see that under microscope. You can search that. You'll see how white blood cells engulf the pathogens.
What the heck?
Yeah.
That's amazing.
So 70% Alzheimer, heart attack, 50% patients in their arteries, those bacteria are roaming around. Heart attack, strokes, also adverse outcome from pregnancy, 12%.
These are big numbers. These are huge numbers that you're mentioning.
95% with diabetic patients.
Wow.
Yeah. So we test for those. Now the patient.
And there's a direct correlation between them and them. I know the visibility and the numbers are there, but is it the cause?
No.
Oh,
No,
okay.
we're not saying they're the
Cause, right.
but we're saying that they were found in those diseases, but
They shouldn't be there.
they shouldn't be there.
Right,
So,
right.
by being diabetic, that's not the cause, but it could be one of the reasons also.
Yeah.
So there is some imbalance in your body.
Correct.
That's why this bacteria is roaming around.
Okay.
But I can't say it's what it's causing the
Right.
heart
So
attack
that-
or the stroke, but it could be one of the reasons.
Reasons.
Yeah, yeah.
That could be accelerating the problem, the issue.
course,
So you had 4. You said
Five.
you mentioned 5. You
Yeah.
said 5, but I think you mentioned 4 so far, or you mentioned all 5.
So five pathogens we test for those. AA, they have very long names. So it's called, but the abbreviation for that, AA, PG, TD, TF, and FN. And it depends, when we get the result, it comes in a graph and shows us the amount of population, the number of the bad bacteria. So it comes either in green zone, orange zone, and red zone.
Okay.
So, and then when I see, so the progression of a normal periodontal disease, it comes in a slope like this. But once I see the strains,
spike.
they're almost the same height, that you know that you're working with super strain bacteria, super resistant, and then what's next? So what we do, I do ozone therapy and laser therapy.
So you treat that.
Yeah.
Okay.
Yeah, yeah.
Perfect.
Obviously, there are certain cases that I send to the specialist, the gum
Yep.
specialist, but even
Sure.
gum specialists, not many they test. So you cannot work blindly. You have to have a guide. You know what you're working with, so you don't just treat and wish for the best when they come in
Right.
6 months. So what I do, I test, I treat, and retest again after 5 to 6 weeks to see if what we did was effective or not.
Gotcha.
Okay, so something to mention about ozone, I'm pretty sure now more people they know about ozone. It's not something new. It's been used for centuries, and it's been used in Cuba for over 100 years
Okay.
to sterilize. So ozone, so you have an ozone, you have to have a medical grade ozone generator. So you can go online, you can order any ozone machine. But the thing is, the difference between a medical grade ozone versus regular ozone. The regular ozone generators, it uses the ambient air to produce the ozone. So ozone is O3. Oxygen is O2.
Okay.
So O2 transformed to O3 to make this ozone gas or water, which is antiviral, antibacterial, antiparasitic.
Oh.
You're not using any chemicals because the ozone is oxidizing. It's oxidizing, it kills the pathogens. Those pathogens, the bacteria, microscope, and their cell walls, they don't have protective mechanism. So when they're zapped with the ozone water or gas, they die.
Yeah.
Versus our human body cell, most of them, they have antioxidizing agents, so it doesn't affect us. But you cannot inhale it, because it's irritant to the gum, and you cannot put it by your eyes. Those are the 2 areas you want to stay away from. So medical grade oxygen generator, it's hooked to a medical grade oxygen tank. You're getting the purest ozone.
Gotcha.
Okay? Versus the machines that you get from online, it uses the ambient air, and you will produce a product that has impurities and nitrogen, and you don't want to do that. Yes, it's okay to clean vegetables, fruit and vegetables, but not to use it systemically or drink it.
So we got way too technical for an explanation for the layman, right? For the regular people.
Yeah.
But this sounds now like a recruiting tool for traditional dentists to introduce this to their practice or to come over to the holistic side.
Yeah.
Because the benefits that you just described and laid out are life-saving and life-extending practices, it sounds like, right?
It's not only used in dentistry. There are doctors, they inject it in joints to help with the inflammation, back injections. I was talking to one patient. She works in a company where when your house got on fire, they take your belongings and they clean them for you. I was just curious to know what type of chemicals they use, and to my surprise, she said, "Okay, we use this, and the last thing, we have big rooms ozone
It
generators.
zaps.
They put everything in there
Yep.
to make sure that they killed all the the
Right,
mold
right.
and everything,
Yeah.
and then they give it to the customers. So it's been used in multiple fields, not only dentistry.
That's amazing.
Yeah, even cosmetology school.
Yeah.
Yeah.
So we're running out of time. Is there something that we didn't mention that
Yes.
we must mention?
Yes. So patients with mercury fillings.
Oh yeah.
So mercury fillings, there are, if you go to the American Dental Association website and you look at the ingredient of the amalgam fillings, or they call it silver fillings, biologically we call it mercury because the ingredients is 50% or more mercury. And this is by, it's an alloy, it's a mix of metals, okay? So when patients comes in, I don't tell them to remove them. I just tell them what I know about these teeth. They're off-gassing all the time,
Yeah.
mercury. And the way
Explain what off-gassing is.
so basically you have vapor. So every time you brush your teeth, every time you floss, every time you clench, you grind, every time you eat, you're rubbing against that metal. So what happens? It off-gas the mercury. So there is a very old video on YouTube. It's called Smoking Tooth. So they took a tooth that has the mercury filling and they just rubbed it, and they look behind a special screen, they see the gas. Dr. Oz, I always share that with patients. He has a video, and it's an old one, 2016, 2017. He did an experiment in front of the audience, a clear chamber, and then he was rubbing the teeth, and then they had a meter for the mercury
Yep.
from 0 to 60. And there is no safe amount of mercury. So when patients comes into my office, I tell them all the facts, and they want to keep it. That's on them. They want to remove it. I remove it safely. Okay? I don't remove it just like that. I don't just drill it and replace it. We follow a smart protocol, safe amalgam removal technique.
So we have a weekly lunch
Yeah.
with a group of us. Every Tuesday we go from one place to another, but usually it's Sahara. One of my friends couldn't make it yesterday because he was grinding his teeth. Sounds like the gas released and he got sick.
Really?
Yeah, so he was laid up in bed and he couldn't come to the thing, and that's so crazy that you just mentioned that because now I know what his problem was.
It could be, yeah. But it's happening every time they brush their teeth.
Yeah.
But the worst time that vapor release is when the dentist drill it.
Oh.
Because you have heat, right? The high speed. So that's why when the patient comes to my office, they're on 100% oxygen. So they don't inhale anything. I isolate the tooth. I put like a rubber cover around the tooth. So any free particles, the patient, they don't swallow. Or, like the lining of our mouth is like a sponge. Anything you put in your mouth right away is in your bloodstream, right?
Yeah.
Same with the pills for the nitroglycerin for patients with heart issues.
Yeah.
Why do they put it under the tongue? Because the absorption is
It's right
quicker than
through,
taking it orally. So anything you put it in contact with your mucosa is right away in your bloodstream. So conventional dentists, they drill it and the dust everywhere. The assistant cannot suction all that,
Right.
plus the vapor. So what we do, we follow the SMART protocol, which is not put by me, put by our organization, International Academy of Oral Medicine and Toxicology. So patients are on 100% oxygen. The patient is draped from top to bottom, so they don't leave with a free particle on their jackets, okay,
it's all
or
over
their
the place.
shoes. Yeah. And then they go to their house and bring that. If they we were taught that if there is a small mercury spill that the size of the pencil head in a school, they will shut down the whole school. So why is it okay in our patient's mouth?
Yeah. No, it's not.
And you're not gonna be diagnosed with autoimmune disease.
Right.
But that's another thing. I know running behind. I don't
Well, so I'm not going to cut this
Yeah.
short because
Yeah.
this is way too interesting and way too important. So
Yeah.
we'll go as long as we need to go to make sure that everybody gets the information that they need.
Yeah, so patients with autoimmune disease, let's say for example, so I have patients with MS, they come in, or Lyme disease. They want, what I could do for them, I could help them to reduce the toxic load on their body. And so mercury is number one, plus the porcelain fused to metal crowns. Those crowns are also made of metal too. Yes, they have porcelain on top, but the coping is metal. So I can reduce that, I can remove that safely. But it takes up to a year to 2 years to feel for their body to recover, not completely from the MS, but to recover from that toxicity that they were, exposed to.
Right.
But by studies, this is not by me, showed that patients with mercury fillings, again, silver filling, they say silver because the color is silver.
Silver, right.
But the silver is very minor ingredient in the alloy
Filling.
itself.
Okay.
It's mainly 50% or more mercury. It takes up to 5 years for the body to react to that constant, exposure to metal. It doesn't happen right away.
Right.
But then once we remove it safely, it takes up to a year to 2 years for the body to recover from that. And that's where, my part help them to reduce that, toxicity load in their mouth.
So for people that say you have 4 or 5 of these fillings in your
Yeah.
mouth, to remove them, is it 1 sitting, 2 sittings?
It depends, if it's all, and it depends on the patient how, they're comfortable having their mouth
Sure.
open for a while. If it's on both sides, different side of the mouth,
Maybe different.
different appointments.
Yep.
I usually don't cross what we call meridian line, which is, the meridian is like a Chinese concept of energy pathways.
Yeah.
So, and then when you remove, let's say a patient, they come in and remove the right side, upper and lower, I leave a chance for the body to detox on the left side.
Gotcha.
Okay? And then they come in and we'll do the other side. Unless they're traveling and they want to, have everything done, I can do that. But
Right.
ideally, I want to do one side. It depends if they can tolerate both top and bottom. If they have it both top and bottom, I can do it at the same time. If not, and they can only tolerate, one filling or 2 filling, we can divide the appointments.
Gotcha.
Yeah.
Is the recovery the same as if it were just getting a filling?
Yes, yes.
So because you're removing it and replacing it, it's with a safe
So
substance.
replacing it, that's another thing. It's either you're replacing it with a filling, the filling that doesn't have plastic in it,
Yes.
doesn't release BPA, doesn't release fluoride, or if it's a large restoration, and those
Replace
mercury
a tooth?
fillings, they create hairline cracks in the tooth.
Yeah.
Okay?
Tooth is done.
So tooth is done, then the best thing to restore that tooth with a ceramic restoration, whether an onlay, inlay, or a crown. Onlay and inlay.
But you're not going to deroot it. You're going to leave the root.
Of course. Yeah,
Okay.
Yeah. So another thing to mention, snoring and sleep apnea.
Let me ask a question before that.
Yeah.
With you mentioned MS, and I don't mean exposure from nitrous oxide during a dental professional setting. Excessive nitrous oxide,
You mean the laughing gas?
the laughing gas,
Okay.
excessive exposure in a party setting. Does that have any correlation to MS?
In a party setting?
Yeah, well, so people abuse it, like they take it and they woof it, and
Yeah. So you can you overdose on that too. They get high on it.
yeah.
Yeah.
So they're getting high, but but
Causes neurological.
it does.
So because some patients, it's nice to mention that some patients that we cannot use nitrous because
nitrous on.
their body cannot detox from that because they have certain mutation in their genes. Some patients, they have MTHFR gene and the COMT gene. When they have that, I cannot use it.
Well, how do you know that though? What if you don't know?
That's a problem.
Yeah.
But
Okay.
a lot of patients, they come in and they say, I do have the MTHFR gene, so I'm being cautious. But if I use it, I have to use it, then I have something that's called methylated vitamin, because, let's go back. So patients in general, people in general, we are either we're good detoxers, we can get rid of the toxins,
Yep.
or whatever the exposure we are, or we're hoarders. We
Yeah.
keep everything.
Yeah.
So patients with those gene mutations, the MTHFR and the COMT, they don't detox properly.
Gotcha.
And the nitrous gas, it depletes the body from B12. So if it depletes them and they cannot recover back, so what you can do, you can give them a supplement in the office. It's called methylated B12
Okay.
to help them to come back. So some patients, they can tolerate the nitrous and some patients, they don't.
Gotcha.
Because of gene. And same thing with everything else, root canals. Some patients genetically, they're when they get the root canal, they fail because they do have some genes that makes them more susceptible for failure of root canals, regardless of how they were done.
Gotcha.
It's all about body susceptibility, genes. It's not the major factor, but it could be one of the factors.
Gotcha.
Yeah.
Well, thank you for that answer.
But when we do remove the silver, I don't use the nitrous unless the patient wants it. It's just 100% oxygen.
Gotcha.
Yeah.
So you were going to make a point, and I stopped you.
Oh, yes, the laser. So I have a very nice laser. It's called Photona laser. It has a medical component and dental component and aesthetic components.
Okay.
Okay. So with the aesthetic components, I do non-surgical facelift.
Oh, wow.
We're just boosting your cells to stimulate the collagen fibers. Also, the lip lace procedure is called lip lace to boost your cells to start stimulating.
Really?
So the tissue is drooping, coming, relax. With the power of the laser, it opens up the airway. So also that's
This is non-invasive?
non-invasive. There's no downtime for that.
Really?
Yeah. But
I'm
you
gonna,
have to
I'm gonna need that.
Yeah, but you have to have home sleep study prior, just to make sure you have no sleep apnea. Even if you have sleep apnea, mild, moderate, severe, that will be an adjunct and helps with your sleep apnea,
Gotcha.
improve your results. Yep.
So I went for a sleep apnea test
Yeah.
years ago, and they found that I had sleep apnea, and I didn't do well with the CPAP. So I went in, and they hollowed out my nasal,
Yeah.
and they cut my uvula out, kept my tonsils, but it didn't help
didn't.
that much, but it did help a little bit. So I use nose strip at night and
Yeah.
mouth tape.
Yeah. And mouth taping is different type. What do you use?
Just a tape.
Okay.
I don't know
I'll
what
talk to
it
you
is.
about that.
All right.
But I do mouth taping too.
Okay,
Yeah,
good.
Yeah. Yeah.
So what is there anything else that we
There's a lot to cover, but I think
got?
yeah.
Okay. All right.
If you want to invite me another time.
I will. I definitely will. And I'm definitely going to come to see you there
Yes, of
at the
course.
practice for sure.
You're welcome.
Regular cleaning and stuff. I'm very conscious about everything that you mentioned and the foods and I mean, if you're going to put something in your mouth, then it should be somewhat safe, right? It should be safe
Yeah.
because you don't want to overwork your immune system.
Because even inflammation, so a lot of issues in the mouth is coming from your gut.
Right.
So if you have inflamed gut, and if you have other issues, you're going to have issues in your mouth too.
Yep.
And that's the whole body, unfortunately, whole body mouth connection. Patients suffer from the disconnect between the dentists and the providers, their cardiologists and other. They don't. Sadly, the doctors, let's say for family practice, they don't get any training about oral health and what could, the cause of systemic issues. So they only get 1 to 2 hours the whole 4 years.
Yeah, they're working on teeth.
Yeah.
That's it. Yeah.
No, but the education about the mouth, the doctors, they only give them 1 to 2 hours.
Right. That's not enough, obviously.
Versus us as a dentist, we know a whole lot of the body versus the doctors, they know about the mouth. And the mouth is this small, but the body is bigger.
Yeah. Right. Well, thank you for coming out. We end every episode with a final question, and the question is, what does it mean to you to be Chaldean?
What does it mean to me to be Chaldean? Part of the culture
Yeah.
and the area that I came from.
Okay.
Yeah.
All right. Well, thank you very much. This
you.
was very eye-opening, enlightening, and beneficial. I think the audience was treated to a very eye-opening session today. So thanks.
Thank you. Thank you for having me.
For sure.